I welcome everybody to this webinar on enhancing local and national OPD participation in humanitarian coordination. We're really pleased to have you here with us. Before we get started, I'm going to hand over to Yelena, our colleague from the International Disability Alliance, to take us through the accessibility features of the webinar today. Over to you, Yelena.
Hello, thank you so much, Kirsten. Welcome all. My name is Jelena Jezdovic and I'm supporting DRG Secretariat. And I'm going to briefly explain you some of the technical features of today's webinar. This webinar is being recorded and there is international sign interpretation, captioning in English, and language interpretation in English, French, Spanish, and Arabic. A CC button on the bottom of your screen will enable the closed captions. And if you need captions, I will post it out in the window, the link in the chat box. The interpretation button on the bottom of your screen, presented as a globe, will allow you to access specific language channel. Please choose your channel that you will follow throughout the whole event. We request all panelists to kindly keep to the time and keep their cameras off if not speaking. And we would also kindly ask them to speak slow enough for the interpreters and captioners to follow. The participants don't have an option of opening the microphone and video. However, if somebody would like to speak, they can raise their hand off. During the Q&A section, you can post your question on the Q&A or chat box, and our team is monitoring the chat box and Q&A, and we will respond to the questions during the webinar. If you have any accessibility issues, please send me a private message and I will support you and respond. Once again, welcome, and over to you, Kirsten.
Thank you very much, Yelena. Once again, welcome everybody. I will very shortly be handing over to Jose Vieira from the International Disability Alliance to formally welcome us to this webinar. But before doing that, just to give you a brief overview of what brought us here today to this webinar. So this webinar is organised by the Disability Reference Group. The Disability Reference Group has just been confirmed as an IASC associated entity, but we have existed since 2020. The Disability Reference Group is co-chaired by the International Disability Alliance, by Humanity and Inclusion, and by UNICEF. And we're a network of about 550 members of OPDs, UN entities, and NGOs working together to advance disability-inclusive humanitarian action. Now, this webinar today is being held to commemorate the International Day of Persons with Disabilities, which is held on an annual basis on the 3rd of December each year. This year, we decided to focus our event on localization, and specifically on participation by local and national organisations of persons with disabilities, OPDs, in humanitarian coordination. Now, this has come out of the increasing commitment and the increasing interest within the humanitarian sector on localization, and within that, a recognition that local organisations of persons with disabilities shouldn't be left behind. Recently, the IASC released a guidance on strengthening participation, representation, and leadership of local and national actors in IASC humanitarian coordination mechanisms. Within this guidance, there is an indicator on participation by local and national OPDs in humanitarian coordination. However, one of the challenges that humanitarian actors face is in understanding who is a national or local OPD. And this question is a really important one if we're looking at monitoring their participation. So, to address this challenge, the DRG has been working for the past 18 months or so to develop an operational definition to help humanitarian actors with exactly this issue. We've consulted widely with our members, and in particular, we've consulted with organisations of persons with disabilities, with really great support from the International Disability Alliance. So the webinar today will be an opportunity for us to formally launch this operational definition and to have a conversation with OPDs as well as with humanitarian actors on how we can ensure that OPDs are meaningfully engaged as partners in humanitarian coordination. So I'm really pleased to hand over now to Mr. Jose Maria Vieira, who is the Executive Director of the International Disability Alliance, to formally welcome us to this webinar. Over to you, Jose.
Thank you, Kirsten, and good morning, good afternoon, good evening, everyone. First of all, I really want to extend our most sincere appreciation to the organizers of this webinar, as well as to all participants. Indeed, December 3rd is an important date for the disability community, but clearly it is more important when we commemorate the day of the International Day of Persons with Disabilities, addressing specific topics. And clearly this webinar, in my view, aligns with this idea of really moving forward from more general discussions to more specific and targeted discussion. I believe this is at this point kind of like a precondition for really advancing the implementation of the Convention on the Right of Persons with Disabilities. On behalf of the International Disability Alliance, we are pleased to see that while there is still a lot to be done in the humanitarian agenda in general, one of the biggest and greatest achievements, and something that we should all be proud of, is how the disability community has been organized and aligned behind one common goal within this important agenda, the agenda on humanitarian action, and that is how to ensure that organization of persons with disabilities are in the driving seat of this agenda, and at the same time finding structures and opportunities and mechanisms in which other relevant actors, such as UN agencies, member states, and international organizations, do also have a space in this very important agenda. In that sense, I really want to congratulate all those who have tireless work in relation of getting the DRG recognized as a ISC associate member, and also for the fantastic network that we have around the Disability Reference Group. But allow me quickly just share a couple of things regarding to the importance of the localization of this very needed and very important agenda. We have been saying for more than a decade that the real change and the real impact on the life of people with disabilities will only be possible if we manage to translate global achievements into real action and change at the local level. And of course, every agenda, health, education, employment, and the list can be long. It's important to translate global achievements into real action. But I would say that the humanitarian agenda is among all agenda the most important one, not only because of the urgency that the reality is demanding us to operate in, but also because the humanitarian agenda is one of the very few that requires a lot of coordination across different stakeholders and from different perspectives. So in that context, we believe that the localization of this particular agenda is so important if we really want to make a difference and we want to create meaningful impact for the life of people with disabilities. And as I said before, at the global level, we always advocated, and we continue doing so, for OPDs to be in the center. So clearly, this webinar is in a way the natural next step, which is how can we put OPDs in the center of this localized agenda when it comes to humanitarian. Um, and I think there are a couple of preconditions that we should pay attention and hopefully will be discussed throughout this webinar. Being the first one, how can we strengthen the capacity of organization of OPDs, local and national OPDs, to meaningfully engage in this important agenda? And clearly, the DRG has played a unique role in understanding the needs and priorities of OPDs, but at the same time, developing tools that are enabling organization of persons with disabilities to meaningfully engage. The next precondition, in my view, is really to take a moment and reflect what it means meaningful when we say meaningful participation. Clearly, we have seen that so far we have been successful in what we can define as being in the room, being recognized as a relevant interlocutor in this discussion. However, that's not anymore enough. We need to bring knowledge, we need to bring experience, we need to bring expertise to the discussion. And so we can say that participation now is not just being present, but also contributing to those discussions. And for that, again, we need further investment on capacity strengthening. The last precondition, and I'm sure there are many more, and I hope that throughout this webinar we will hear more of this very fruitful conversation, is how we can interact with other stakeholders involved in this agenda. And the DRG is another, once again, the best example in which OPDs, the UN system, and other stakeholders come together and really promote an equal, meaningful, and holistic interaction across the different stakeholders. I think when we look at the localization of the humanitarian agenda and how to put OPDs in the center, we just need to always keep in mind maybe three keywords. Number one is strengthening capacities of OPDs. Number two, making sure that OPDs can deliver and not just say nice words, but also be able to deliver. And number three is to find a space within this agenda for every single stakeholder interested in participating in this agenda. I really hope that this webinar can bring some clarity and some further discussion on how we can advance the engagement of OPDs at the local level in this very important agenda. Thank you very much.
Thank you very much, Jose, for those really important words to start off our conversation today. I'm really pleased now to be handing over to Joyce Mutiso, who is representing the Localization Working Group of the Global Cluster Coordination Group. Joyce is also the Deputy Coordinator of the Child Protection Area of Responsibility and works with UNICEF. And Joyce is going to be speaking with us about how this operational definition can contribute to monitoring local and national OPD participation in humanitarian coordination as part of a broader localization agenda. So thank you, Joyce. Over to you.
Thank you, Kirsten. Good morning, good afternoon, good evening, everybody. I'm pleased to join you on behalf of the Global Cluster Coordination Group and its Localization Working Group. It's a pleasure for us to be here today to look at this webinar on enhancing the participation, representation, and decision-making of national and local organizations of persons with disabilities in humanitarian action and coordination. As interagency bodies, clusters recognize the importance of humanitarian action and coordination that is not only inclusive, but also accountable. The operational definition of local and national organizations for persons with disabilities for the purpose of monitoring engagement in humanitarian action is an important step forward and will contribute significantly towards effective inclusion and accountability. As Jose has just mentioned, it is important for us to remember that engagement must be meaningful to the affected population, and in this case, particularly for persons with disabilities, including children. So it is not enough to be in the room. It is not enough to be at the table, but engagement must enable us to participate, to represent, and to make decisions as a collective. Kirsten also mentioned that yesterday was the commemoration of the International Day of Persons with Disabilities, and today we are having this webinar in line with the commemoration of this day. The theme for this year is amplifying the leadership of persons with disabilities for an inclusive and sustainable future. I hope you'll all agree with me that there is a strong link between this year's theme and the aim of today's webinar. Local and national actors, including organizations of persons with disabilities, play an indispensable role in advocating for the rights and inclusion of persons with disabilities, including children. They ensure that disability is not a forgotten issue. They ensure that disability does not automatically result in exclusion. And they also remind us of the deliberate efforts and investments that we must all make for more inclusive and accountable humanitarian action and coordination. The localization working group of the Global Cluster Coordination Group appreciates the opportunity that was given to us to contribute to the development of the definition. This definition, which we will discuss today, will be an important tool in helping us advance our actions on inclusion, and even more importantly, in monitoring those actions. As we all know, what gets measured gets done. We are happy to say that we have seen some positive shifts recently in the inclusion of disability perspectives within humanitarian coordination structures. I'm going to share some examples of this. One is the Age and Disability Technical Working Group in Ukraine, which is led by the Protection Cluster, that advocates for the inclusion of the needs of older persons and persons with disabilities in the response in Ukraine. A second example is in the Democratic Republic of Congo in the Education Cluster, where we have an inclusive education effort to advocate for inclusion of children with disabilities in the provision of education services and development of policy. The third example we are going to share is in Myanmar, where we have the Technical Advisory Group, which is an interagency group supported by OCHA, and the Technical WASH Group, that is the Water, Sanitation and Hygiene Task Force, that also looks at disability inclusion, supported by UNICEF and humanity inclusion. These are just some examples of some progress that we've seen recently. And while we reflect and recognize this progress, we also acknowledge that a lot remains to be done. The challenges are complex within the humanitarian system, so we must all continue to do more, to be more inclusive, and to be responsive to affected population, including persons with disabilities, and not forgetting children. I will leave us with an inspiring word, which is to say, together, our efforts can create a future where persons with disabilities are not only included, but are driving the change that we wish to see in terms of inclusion. We are very happy to join today, and we are very happy to participate in the discussions in this webinar. Thank you.
Great. Great. Many thanks, Joyce. Thank you very much. And we're really pleased to have the Global Cluster Coordination Group joining us on this webinar today. And I think your closing words, Joyce, about persons with disabilities driving change on inclusion are a really great entry point for us to go over to our next panelist, who will be Abia Akram. So Abia Akram is the CEO of the National Forum of Women with Disabilities in Pakistan, so a national OPD. Abia is going to speak with us about the barriers and enablers to participation that she has experienced. Abia, we're really interested to hear from you, from your observation. What are the key systemic barriers that hinder local OPDs in accessing and effectively participating in humanitarian coordination? And can you share some examples of strategies or actions that have enabled greater inclusion of OPDs in these mechanisms in Pakistan? Happy to hand over to you. Thank you.
Thank you. Thank you so much, Christine. Thank you to the International Disability Alliance and all the organizers who have organized this very important discussion today while we are globally observing the International Disability Day. And we also talk about the 16 days of activism against the violence against women and girls with disability and overall with all the diversified groups. It's really important to talk about the humanitarian context as Jose have already mentioned about the inclusion of the organizations of persons with disability. I congratulate that's a huge success to have this group working on the inclusion in the ISAC guidelines and monitoring engagements and how the organizations of persons with disabilities are playing the important and the leadership role. It took us 2 decades to talk about the inclusion of persons with disability in the humanitarian context. Because when we started the work, we were witnessing that all in the South Asia or mostly in the global South, the persons with disabilities, they were dying in the humanitarian response because disasters are always inclusive, but the response was very limited to talk about the diversity of the disabilities. We were seeing women with disabilities were dying at their homes and nobody was there to protect them, to provide them the basic emergency evacuation support. In the recent like earthquake and floods in Pakistan, we had witnessed like a huge number of persons who became disabled. They were also not getting the access to the services. Gender-based violence, sexual harassment, they were the first one who got all those challenges because the people who came to rescue them, they were not aware about providing the services, and it created a lot of challenges for them. But again, like we have seen this change coming through by the organizations of persons with disability with their collective voices. We have established the Aging Disability Diversity Task Force within the Protection Working Group because we thought like it's very important to have the seat on the table and the voices of the organizations of persons with disability within that humanitarian and the UN systems. So at that time, when we worked together with the UN to establish this task force, we engaged the international organizations like Savers, CBM, Handicap International, all those key organizations were taking the lead. And also the organizations of persons with disability, they were sitting on the platform to talk about their rights. And at the same time, we were talking with the permission, like how to collect the data, the segregation of the data. So Washington set of go for questions we can include, how we could take the practical examples of the accessible infrastructure, shelter, all those services we can provide, which is consulted by the organizations of person with disability. It gave us a lot of opportunities to develop the tools, evacuation plans, emergency response. We also developed the equal access mobile application, and that mobile application was connected with the National Disaster Management Authority. So the State Department have taken that initiative as their own, and they said like our information is not accessible, so we need to connect it with that. So we talk about the refugees with disability, we talked about the women and girls with disability, and this gives us a lot of opportunity to talk about the intersectionality and approaches to reach on the global agenda. And the ISAC guidelines we also reviewed from the regional perspective and on the country perspective as well, because that was the point we were seeing, like how to address that gaps that hugely existing in the disability movement. So that also given us a lot of opportunities. We have created the Global Forum on the Leadership of Women with Disability. We created the Asia Pacific Forum on Women and Girls with Disability, South Asia Women with Disability Network. All these platforms were just complementing the work we were doing to secure that space. And we were also part of the WIN DRR, just to give the DRR context and the emergency response, how connecting the dots. It's not only about the humanitarian response, but also the development perspective need to be worked together so we can create that change. And I always say it's a twin track approach, like without the engagement of the state departments with the key stakeholders, we cannot achieve much. And same time, the organizations of persons with disability, voices of women with disabilities are critically important. And as we all say, nothing without us. So this is the time to take that opportunity, take the pledge to not only observe the day, celebrate, but we need to think how we can protect those persons with disabilities who are living in the disaster-prone areas, who are still facing that challenges. So thank you very much. I'm really grateful to be part of this discussion. Thank you.
Fantastic. Thank you so much, Abia. Really, really great to hear from you, to hear from your experience in Pakistan and the region, and particularly to hear about the intersectionality between gender and disability, and to make sure that where we are engaging local and national OPDs, that also includes women-led organizations. So thank you very much for your insights. I'm now going to invite to the panel Mr. Ibrahim Hamisul Alassane, who is the co-coordinator of the education cluster in Niger. Mr. Ibrahim is going to share with us the perspective from a country cluster on working with local and national OPDs in cluster coordination. For Ibrahim, I have two questions. So, Ibrahim, from your experience, how do you ensure that the voices of OPDs are not only heard, but also influence in a meaningful way decision-making and prioritization in humanitarian coordination? And if you have any ideas for us on how clusters can foster more meaningful engagement of local OPDs in their work. Ibrahim, I will hand over to you.
Oui, merci beaucoup, Christian.
Thank you very much, Christian. I represent the country cluster for education in Nigeria. I will speak in French. I am hoping it will be fine with everyone. Hello, do you hear me?
Yes, Ibrahim, we have the translation. Yes,
yes.
Go ahead.
Okay. So thank you very much once again. As I said, I'm representing the education cluster in Niger, and I would like to present to you our experience. So to begin, in my country, we have an association that which is called MBH. It's an association that groups a certain number of organizations, 25 organizations that are separated into groups. 7 organizations are dedicated to persons with disabilities, and others, the 18 are dedicated to, yes? I'm sorry. I'm not hearing anything. The translator here, I don't hear anything.
Ibrahim, on the English channel, we hear you.
Yes, you are hearing the translator on the English channel, but the translator doesn't hear the the speaker. The translator thinks that we lost contact.
Okay. I think he's back. Yeah, we have some, I believe, connection issues.
I'm sorry. Do you hear me? I'm sorry. I lost the connection here. So as I was saying, our federation we have 25 years of experience, and we have a lot of developed programs, a lot of diplomatic connections and contacts that concern inclusion of persons with
Elle joue vraiment un rôle très important dans l'élaboration de tous les textes, comme j'ai souligné.
And we have developed a specific text concerning the persons with disabilities and their inclusion in education. We are developing many programs that are protecting persons with disabilities. We have a main project and another project for speeding up the process of inclusion of persons with disabilities, which we are doing with partnership with IDA. Right now, when we're talking about the 7 federations that are regrouping the organizations with persons with disabilities and their participation in political decision making and policy decision making. We're also following our education cluster, and we have activities of raising awareness, and we are trying that federation helped develop the definition of OPDs in Niger, and they gave also many indications of how to develop the definition. They have also contributed to campaigns of raising awareness on the domain, and the Federation of Persons with Disabilities are also doing a lot of activities like conferences, seminars, participations in communities, so contact with and activities with local on local level, and also accessing persons with disabilities in different regions of our country. So although we had a lot of progress in this field,
allons prise en compte du Fonds national de soutien aux personnes handicapées, parce que vu vraiment la coalition de ces 25
we have a coalition of our organizations
d'une initiative
and they have an initiative trying to encourage the work of persons with disabilities and their inclusion in education.
De leurs besoins un peu partout, mais le respect des textes qui sont déjà prévus, que ce soit au niveau du politique.
So we are also trying to impact the policies and texts and policies that are already set on table, and the future text and future policies. So that's what I would like to share with you. And the Federation of Persons with Disabilities in Niger. Thank you. So thank you, everyone.
Fantastic. Fantastic. Thank you so much, Ibrahim. It was really great to hear of your experience in Niger and to get that very important country perspective on very practically how you have worked to ensure local and national OPD participation. We're going to move on now to our next panelist, who is Barbara Achwe. So Barbara is working with CBM, and Barbara is the Disability Inclusion Coordinator for the Leave No One Behind project, and is also the Disability Inclusive Development Officer. In addition, Barbara is a person with a disability and is a disability rights activist. So Barbara is going to share with us learning from Cameroon on how OPDs have engaged in humanitarian coordination. Barbara, welcome. I also have 2 questions for you. So firstly, how have OPDs influenced humanitarian needs assessments and response plans in Cameroon, and what challenges did you face and how did you address those? And also, based on your experiences, what best practices can ensure that OPD contributions are not just symbolic, but have a real tangible impact? So Barbara, the floor is yours.
Okay, thank you, Christian. Thank you for the opportunity given to CBN to discuss on what we have been doing in line with the Leave No One Behind project. Good morning, good afternoon, good evening. I don't know where you are following from, but as Christian mentioned, I'm the DI coordinator for the Leave No One Behind project, who I also act as a Disability Inclusive Development Officer for CBN Cameroon. So I'm looking at OPD's involvement in terms of the humanitarian response in Cameroon. I would just like to first start with a brief background on the context in Cameroon. Looking at the context in Cameroon, we have two crises as per se. We have the crisis in the far north. We have the refugee crisis in the east, of which we have refugees that are coming from the Central African Republic, and we also have the Anglophone crisis, which is being affected in two regions, that's the north and the southwest regions of Cameroon. So during this crisis per se, most OPDs were not like really involved in the humanitarian response for Cameroon. More to that, CBM was acting as a link between these OPDs and the humanitarian coordination system in Cameroon. So based on that, we just have some few OPDs that could really understand what humanitarian response was all about. So due to that, we had to capacitate these OPDs. But how did we capacitate them? During the coming of the Leave No One Behind project, we started in 2020. We had subsequent projects that engage OPDs in humanitarian coordination meetings at the regional levels. Even CBM itself always participates at the national level in terms of humanitarian coordinations meetings to discuss on the involvement or on how to mainstream disability inclusion. But our main goal was to ensure that OPDs take the lead in terms of the operationalization of the EAS guidelines. But how can they take the lead of which they are not well capacitated? So in the coming of the Leave No One Behind project, which was in 2022, we had to do an OPD mapping in Cameroon within all the 10 regions to ensure, to get to know the involvement of OPDs in humanitarian coordination and also to understand their level, their capacity level on what the humanitarian coordination is all about and how they can fully get involved in it. So I think this mapping, these baseline studies gave us a groundwork on how to develop the various activities based on the project. Because based on that project, we came to realize that most OPDs still lack the understanding, do not have the capacity to better advocate, do not understand what the coordination is all about and how they can really get involved. So within that, we now draft a plan of action based on the Leave No One Behind project, of which we aim at capacitating OPDs within Cameroon. As I mentioned, CBM was already organizing some trainings for OPDs, but this was just focused for the two regions, that's the North and Southwest regions. But with the Leave No One Behind project, we had to capacitate OPDs in terms of mainstreaming disability inclusion, and also the humanitarian organizations themselves, because most of the organizations that were implementing were just doing like a representation, but not actually meaningful participation. So in that, we had to train OPDs, we had to train UN agencies, we had to train persons with disabilities on the operationalization of the EAS guideline and the effective advocacy in terms of humanitarian response in Cameroon. So during that period from 2022 to 2024, now that we are in, these OPDs that were being capacitated are now being influential in humanitarian coordination systems in Cameroon. Because from 2022 to 2024, we have been much more engaged in the development of the humanitarian response plan. And these OPDs participate in the trainings, and they also support as technical advisory team to review project proposals and also review HNO and HRP to make it to be more disability inclusive. And this can be seen in the 2024 HRP that was developed with a lot of indicators focusing on disability inclusion. So coming to your next question, I can say it has really been good because we had to train these OPDs, and within the training, we had to do like a selection. And more to that, being as a person with disability, I also act also at the forefront in ensuring that OPDs participate in regional protection or health cluster or WASH cluster, all the cluster meetings in ensuring that their voices are heard. So with OPDs, we had to review, we had to review over 93 projects that were submitted to the protection cluster for the HRP 2025. And due to that, this 2024, since CBM, our focus is that OPDs should have the lead, not us being seen, but the OPDs. So we are capacitating them so that they could have the lead in the involvement of the humanitarian response in Cameroon. So we had to train over 14 selected OPDs within 7 regions in Cameroon who are now acting as disability inclusion pool of experts. So these OPDs are there to co-facilitate trainings. They are there to review documents sent by humanitarian organizations. But some of the challenge that we are still having is that most UN agencies, most INGOs or NGOs still refer back to CBM for technical advice. So when this request is being sent, we now have to now link them with these OPDs. But our end goal is for them to work in close collaboration with these OPDs. So per se, in almost 4 regions, we have UN agencies that are working in close collaborations with these OPDs. Because during the HNO and HRP development, I was also there with some humanitarian organizations. We had discussions on how to collaborate with some OPDs that were there. And I think it has really been good, it's yielding a good fruit. So, but our end goal is for us to establish this pool of experts within the entire nation of Cameroon so that they themselves can better advocate, they themselves can better support, they themselves can provide that technical expertise in terms of disability inclusion by operationalizing the EAS guidelines of disability inclusion and humanitarian response. So I can say in line with OPD's participation in the humanitarian response plan for Cameroon is very, very good, and it's a good practice that we have been doing. And the second aspect is the collaboration. That's the basic, the level, the collaboration that we had with UN OCHA and UNICEF. When we started, it was not that really easy, but I think we have been doing a lot of advocacy. I myself have been participating in a lot of trainings. I've been training them, training a lot of cluster at the national level, trainings with UN agencies on mainstreaming the EAS guidelines. So there is this collaboration that we have with UNICEF, because so far, in 2023, we organized a high-level training, because one thing we discovered was that most organizations, when they call for maybe a training for disability inclusion, the staff they sent to these trainings are staff that could not really cause change within the organization. So we had this collaboration with UNICEF at the national level. We organized a high-level training to train country directors and program managers in order to mainstream disability inclusion by operationalizing the EAS guidelines. And so far, we have been having a lot of results, good results on how to mainstream disability inclusion, a lot of requests that are being coming in. And also this year, still in collaboration with UNICEF, we organized 2 development trainings for humanitarian organizations in order to better capture disability inclusive data. And with these, all these activities, OPDs are at the forefront to ensure that the trainings that they are giving is disability inclusive, and they themselves participate as co-facilitators within this training. So I think so far so good. We have been doing a lot in line with the Leave No One Behind project, and also with what CBM is doing in Cameroon. Thank you.
Fantastic. Many thanks, Barbara. It was really, really great to hear from your experience in Cameroon, and particularly to hear about the importance of capacity
Merci beaucoup
sharing.
d'avoir partagé avec nous vos expériences au Cameroun.
Sorry.
Please.
Yes, sorry. The French translation was coming through. I was just checking I was on the right channel. No, thank you, Barbara. Really great to hear about the experience in Cameroon.
Il est très important.
Sorry, the French translation's just coming through on the English. And to hear about particularly to hear about the capacity sharing and recognizing that both OPDs and humanitarian actors have really important skills and knowledge, and what's key is for them to really be able to have opportunities to share and to learn from each other. So thank you very much.
Yeah, most welcome.
Great. Now, we're now going over to our next panelist. So from Barbara, we heard about the experience of CBM, which is an organization that has a strong mandate and experience on disability inclusion. But next, as our last panelist, we're going to hear from the International Rescue Committee from IRC, which is a more mainstream humanitarian organization, and we're going to hear about their experience in working with national and local OPDs, and this time in Lebanon. So we're hearing from different regions around the world. And we're really happy to have with us Karine Bejani, who is the IRC Partnership Coordinator in Lebanon. Welcome, Karine. And Karine, I have 2 questions for you. Firstly, as a mainstream humanitarian actor, we're interested to hear about what steps the IRC has made to better collaborate with OPDs and what have been some of the outcomes. And also, how do you think international humanitarian organizations can more effectively shift power to locally led organizations such as OPDs? Handing over to you. Thank you, Karine.
Sorry, Karine, we cannot hear you. If you can unmute yourself, thank you.
Yes, sorry. I was just saying, Kirsten, I would need to write the questions down, please. So if you could just give me a minute.
Absolutely, absolutely. Take your time.
Okay. Hi, everyone. First of all, as a humanitarian actor, the IRC is always ensuring to collaborate with OPDs in Lebanon. We mainly reach out to OPDs in Lebanon for almost all our projects when and if of course if this is available if this opportunity is available. Now, in this case, the one that I'm going to discuss now, what we have started doing as part of our S100, our strategic approach for the IRC in general, is that we started working on strategic partnerships. So strategic partnerships are beyond any monetary value, if we want to call it this. We don't necessarily work on a specific project with an OPD or with a local organization. However, we focus more on strategic outcomes, on whatever capacity sharing the organization or the local actor we can benefit from each other, the local organization and IRC, of course. In the case of strategic partnership in IRC, we have two criteria. One is the scope for the partnership to expand the impact and scale of the response and improve outcomes for people affected by crisis. Now, the second one is the extent to which our respective visions, missions, values, and strategic priorities align. And this is where it's very important for us to pay particular attention to organization led by or focused on people disproportionately impacted by crisis and systemic inequality, including persons with disabilities, refugees, displaced people, LGBTQI+, and other marginalized minority groups. So in this case, IRC had been already partnering with an OPD. This OPD is the Lebanese Union for People with Physical Disabilities, LUPD. It's a women-led, women-focused organization that has been founded in 1981. Now, I don't want to go into all the details of LUPD and IRC, of course, but I will say that this is one example on how we made it better to collaborate. Of course, we also we have inclusive design when we are designing our programs and our projects. We make sure that they are all inclusive and that OPDs and persons with disabilities are also represented. Now, in terms of power shift, this is a big question. However, I can say that when we are working constantly with the organizations, with the OPDs and other local organizations on capacity sharing, when we are including them in decision making, when we are including them in design processes, when we are partnering as equal and not as and not playing the role of a donor, then and of course always respecting the fact that they are the experts in their fields, and IRC will actually be learning from them. So this is extremely important to note in this, to note here. And this is what we have been doing with LUPD and other actors as well. So it's an ongoing effort. It's also part, of course, of the localization efforts that the power can be shifted. It just needs a bit of effort from both sides and time. I hope I answered your questions. I also had a bit of a small presentation on LUPD and IRC strategic partnership, but if that doesn't, if we don't have time, then I'm good.
No, thank you so much, Corinne. You answered the question really well. I'd be happy. We still have a minute or two. If you'd like to take a few minutes to share, you're very welcome to, but otherwise we can also go into Q&A.
No, I'll be happy to actually present a bit about the 1 second. Let me share the presentation. Okay. So I went through a bit on the background for both IRC and LUPD. I'm just gonna say here that the partnership originally started with LUPD in 2020, and we worked together on advocating and empowering women and girls with disabilities, on advocating for their rights to access protection services and programs. Now, this relationship evolved massively. And in January, originally it was in January, but then in May 2024, it has evolved to become a strategic partnership, as I mentioned, where only non-monetary values were actually shared. We have been, I'm just going to go through the objectives very quickly. It's about promoting knowledge sharing between both organizations, enhance physical service accessibility, create inclusive tools, technical tools across different sectors and departments, and champion comprehensive sector level intervention with a specific focus on inclusivity of women and girls with physical disabilities. Now, we have been benefiting a lot from the capacity sharing part, and we have been learning a lot from LUPD. LUPD have already conducted inclusion assessments for our centers, and they have recommended action plans. They have also conducted a training on disability inclusion for our for IRC team members. And the work is still ongoing because we are also focused on learning on learning from them on how to design inclusive projects. Sorry. Yeah. 1 second, please. Yeah, on how to design inclusive projects and how to enhance the hiring processes for individuals with physical disabilities. Our HR team is also working closely with LUPD into making sure that those things are possible for IRC as well. The learning that LUPD is also getting from IRC is around human resources, communication, supply chain, etc. We are also helping them and supporting them in the development of the gender policy with guidance from our JEDI and WPE advisors. We have also shared with them tools and materials on women protection and empowerment sector. So this is it. These are of course, the partnership principles that we have been sharing with LUPD as well as other partners. It's based on trust, shared goals, strength, transparency, equitable contributions, flexibility, and adaptability. Thank you.
Fantastic. Thank you so much, Corinne. It was really helpful to have this presentation on the strategic partnership. I think it was really interesting to hear from you and the experience in Lebanon on how, in a very practical way, a partnership can be established between a humanitarian organization and a local or national OPD, and really the mutual benefit in that partnership. And I think your point on the partnership being truly equal was a particularly important one. So thank you very much.
Thank you, Kirsten. Thank you, everyone.
So we've heard today from a really wide range of panelists, everything from the Global Cluster Coordination Group to Country Cluster. We've heard from local and national OPDs themselves at country level, and we've also heard from some NGOs at country level. And it's given us a great opportunity to hear about some of the issues, some of the approaches that are working, some of the challenges around partnership between humanitarian actors and local and national OPDs. So, benefiting from having such a great panel with us to share their learning and experience, I'd like to open up for questions. If anybody in the audience would like to ask questions of our panelists or would like to share any of your own reflections, any of your own experiences and learning from your setting, the floor is open. Please feel free to come in. I'm not yet seeing any hands up, but I'll just give it a few minutes. There always has to be one brave soul who is first. So see if anybody would like to come in. I see many familiar names in the chat. I think we also have some in the participant list. Sorry, I think we also have some really great experience in the room. Maybe to break the ice, I can come in myself with a question from the DRG co-chairs. So we heard a lot of really interesting examples of practical strategies that can be used to strengthen engagement of local and national OPDs as partners. I'm curious to hear whether any of our panelists have any reflections on the role of donors. So what can donors do to better ensure that local and national OPDs are accessing humanitarian funding and are engaged as equal partners in humanitarian response? Checking if anyone would like to come in on that one. Or anyone from the audience.
Okay, Christian.
Great, thank you.
Yeah, okay. Thanks for that question, because this same question was the reflection that we are having. I think, let me see, myself as the DI coordinator for the Leave No One Behind project. The project is coming to an end, but now we want to, like, okay, if in case we have a phase 4, what can we really do, or what can we really say? So as I mentioned, most of these organizations, most of these implementing partners, they're just there to tick the box. To tick the box. Actually, we had this number of persons with disabilities that were present in our meetings, that were present in our activities. But for me, I think that what we can do, and what donors can do, is for them to put a requirement. This is being required when organizations are requesting for funds. The inclusion of persons with disability, or the meaningful participation of persons with disability, or organization of persons with disability should be very, very clearly spelled out, so that if this money is being given, they themselves now will better understand that there is high need for meaningful participation of OPDs in project implementations. Because most of the times, these organizations are left behind. Looking at the context where we are, I'm taking from the context in Cameroon, we have a lot of organizations that are out there doing, implementing projects, but you still lack the expertise for the involvement of OPDs in certain areas. In most of it, let me say, in most of these implementing areas or contexts where they are. So I think if the donors should, like, clearly spell out that this is one of our requirements, we need to see the full or the meaningful engagement of OPDs in project development and in project implementation within humanitarian response. I think it will go a long way. Thank you.
Fantastic. Many thanks, Barbara. That was a really, really helpful response. Thank you. I see we also have a hand up from Ibrahim. Ibrahim, over to you.
Yes, Christine, let me maybe talk in French. Merci beaucoup pour cette question.
Thank you very much for this question, which is really very important.
Ok, merci beaucoup, Christine, pour cette question qui est très importante.
This is a very important question, and thank you again. It's a key question, which is very important for all our activities. Considering the donors, I can highlight the consideration. We have seen that uh, they had a good practice for an expert mission. They had to collaborate with the organizations, with the OPD, in order to participate in the reduction of. We have some interruptions. Now we have.
The other thing that I can underline, that's the program itself. There is one thing is writing a project, and the other one is implementing it. And it's a small window that we have where we can allow the organizations with a lot of experience to share their project ideas and implementation of their projects. And that's a way to allow the inclusion of persons with disabilities and the promotion of their work and the OPDs. And that's what I wanted to share with you. Thank you.
Fantastic. Many thanks, Ibrahim. Really, really helpful reflections on your side. Thank you. Handing over to Joyce.
Thank you, Kirsten, for that question. I want to add on to what Barbara spoke about the inclusion of the national and local actors with disabilities. I think one of the things that we must also remember is that in many humanitarian contexts, children are more than 50% of the affected population. And whilst we may have organizations of persons with disabilities, we recognize that they are primarily led by adults for obvious reasons. And there is something that we have to consider when we are thinking about the inclusion of persons with disabilities, to pay special attention to how children are also included in these processes, so that their views are heard, their voices are heard, and that they are considered in the decisions and actions that are taken in the humanitarian world. It's not something easy, we agree, but as we said, we are all working towards a future where we are more inclusive in things that we are doing, and we must not leave the children behind. Thanks.
Thank you, Joyce. No, thank you for the reminder on that really important point. And I think that that point aligns also very well with the point on intersectionality that Abia also raised earlier. So as we're talking about partnering with local and national OPDs, we need to make sure that this also includes organizations representing children and young people, for example, or women and girls, or refugees has also been raised today. So I'd be very interested to hear if any of the panelists or anyone in the audience has any further reflections on this really important point on how do we ensure that as we're working with local and national OPDs, that this does include all of those groups, children, women, refugees, etc. While people maybe have a few minutes to reflect on that question, I also see that there's a question in the Q&A. So there was a question in the Q&A around, we're speaking here about partnering with organizations of persons with disabilities. A separate but somewhat related issue is that of persons with disabilities working as staff with humanitarian organizations. So I'm interested in hearing also if anybody has any reflections on that question. Separate but somewhat related still. So I'll just pause a moment and see if anyone would like to come in on either of those two pieces. Or any other questions. Always welcome.
Please, can you repeat the question again? The
Yes,
one on staff
absolutely.
working.
Yeah, absolutely. So, not so much a direct question, more inviting reflections on two issues. One being this intersectionality issue. So, how do we ensure, as we're working with local and national OPDs as partners, that this also includes, say, networks of young people with disabilities or networks of women with disabilities, refugees with disabilities, as one area of reflection. And the other one being a related area of how do we ensure that persons with disabilities can be employed as staff within humanitarian organisations?
Okay, I think let me attempt this question because I am also a person with disability and I'm working with an international organization. I think ISWE also starts with the recruitment process. If persons with disability are encouraged to apply and the reasonable accommodations that are being put in place, that's another thing. That's the most important thing that will really ensure their meaningful participation within the organization. So as organizations that we are implementing, or as humanitarian organizations that are implementing projects, we have to also have it in mind that persons with disabilities also have the capacity and to also better participate in project delivery. So if reasonable accommodation, which is the most important thing, is being put in place, this will now ease their work for them to fully participate in in project delivery. For my own, let me use my own case. When I was applying for the position for the DID coordinator, it was clearly stipulated that persons with disability are encouraged to apply. And during the interview process, it was always like, okay, is there any reasonable accommodation that you would need? So when I finally got the job, actually, I had to like start when they will now ask, what do you really need so that you can effectively work? So they had to buy me a smart laptop, which enables me to really work effectively. So I think it is very easy if these humanitarian organizations, firstly, they understand that these persons with disabilities have a lot to put in terms of humanitarian response. So then they make it now open to provide this reasonable accommodation so that these persons with disability can participate on an equal basis with other staff. And also, if the environmental is somehow is accessible for everyone, then these persons with disability can fully express their full potentials. I don't know if I think that's what I have in mind. Thank you.
Fantastic. Thank you, Barbara. Really helpful to hear from a very real and personal perspective. And yeah, very, very practical advice. Thank you. I see we also have a hand up from Andrew. Andrew, can we hand over to you? Elena, are we able to unmute Andrew? He may not be unmuted.
Yes.
Can you hear me?
Yes. Thanks.
Yes. This is Andrew Afokogene David. I'm a person with disability. Let me throw a more light on what is actually going on. What about those in the rural area that don't have an access to the internet facilities, to the mobility aid, and so whatsoever? How can we also include these people in the project? And when you go to the rural area, for instance, there are a set of physically challenged, person with physically challenged or person with disability who are not actually inclusive in the project. They are just abandoned. How can we bring these people out from the interior villages, from their rural area, for the making them to participate on the program? Some of them, they are not even going to school because of lack of mobilities, lack of aid, of working and all. But how can we be able to bring out these people for making them to participate on it? That is my stake for it.
Fantastic. Now, Andrew, thank you so much. You've raised a very important point that hasn't yet come up today, and I think warrants a little bit of reflection on our side. Your point on engaging with OPDs in rural areas who may not have access, for example, to technology or may not have had access to education. We know, for example, that a lot of the partnership procedures are online or require literacy in English, and this really creates substantial barriers to some local OPDs. So I'm curious to know if anybody has any reflections on this point. I see Ibrahim has his hand up, so I'm going to hand over to Ibrahim, and I'm also going to invite anybody else who would like to come in with reflections on that important point. Ibrahim, over to you.
Ta réflexion.
Merci.
Thank you very much.
Merci beaucoup pour
Thank you for this question. I don't know if I understood well the question when it comes to integration of the persons with disabilities and in the NGOs. And maybe, so yeah, Okay, thank you. I would like to say to develop on the question, if I understood it well. For me, for example, in Niger, we have a law that says that that helps the participation of persons with disabilities in every sector, in every activity, and there is a quota for employment, and the Federation of Persons with Disabilities are advocating for the implementation of that law, and very often things happen behind their back, despite all of their efforts. So the 25 organizations that have united to advocate and to impose on the policy and policymakers. So the meetings, that's a really good practice. So we now have a quota that's there, that's present, and it's a really good result that we've achieved within the government. So thank you.
Thank you, Ibrahim. Thank you. Really, really interesting. And actually, your last point on government links us very nicely to one of the questions that we've had come up in the Q&A. So I'm going to address two of the questions that are in the Q&A and check if anybody would like to come in our last few minutes of this webinar. So one is a question around state obligations. So recognizing the Convention on the Rights of Persons with Disabilities, General Comment number 7, and asking whether there are any countries which have enacted a law to enforce these obligations. So it would perhaps be interesting to hear if anybody has any reflections on experiences of OPDs, local and national OPDs, working with governments as part of the national humanitarian response, for example. There's also a reflection here from Juliet from Mozambique, that from CBM in Mozambique, around the process that they're in the process of evaluating HNOs and HRPs, so humanitarian needs overviews and response plans, to inform inclusive humanitarian response planning for next year. So perhaps there may be somebody online who'd like to also share their experience of having local and national OPDs engaged in that process, in humanitarian needs overviews and response plan development. So one question on the national response, partnering with government, and another one on the HNO HRP development process. Checking if anyone would like to come in there. And if not, we are coming very close to the end, so we will soon be handing over for closing remarks. But before we do, Juliet, we welcome you to come in.
Thank you so much. Here in Mozambique, we're working with the umbrella organization of persons with disabilities who are leading a disability working group, which we co-sharing with them as UNICEF. And it falls under the protection cluster. We really work together to support the humanitarian processes to make sure that it is inclusive. And the disability working group is composed of the different NGOs, including the specific organization like Humanitarian Inclusion in Mozambique, to support the humanitarian response processes. And our umbrella organization is really involved at all processes of the humanitarian response. Although usually we tend to get forgotten at some point, but in the post disaster planning, the post disaster needs assessment, that's when we really get involved. So this is what we're trying to influence through the review of the HNOs, HRPs, to ensure that we get a more systematic way to be included together with the OPDs. Thank you, and over.
Thank you, Juliet, for sharing that experience from Mozambique. Really helpful for us to hear of all these different contexts. Okay, so before closing, I just wanted to check quickly if any of our panelists, if you would be interested in coming in with any final reflections on your side. I'll just allow a few minutes in case you would like to come in. And if not, I'd just like to say a huge thank you to all of you, a huge thank you to our panelists who shared their valuable experience from global and country level from very diverse contexts. And also a huge thank you to all of our participants. We had some great questions. We had some great reflections and examples from your experience that will really help us to drive this agenda forward. I think some of the key issues that we heard today, firstly, was that there is a lot to celebrate. We're marking International Day of Persons with Disabilities, and in that spirit, it is important that we do celebrate the gains that have been made. If we compare to, say, a few years ago, we wouldn't be having this conversation. We were still at the point of advocating for OPDs to be at the table. We're now at a point where there is a strong commitment and a strong recognition that having OPDs as partners in humanitarian response is not optional. However, we are still facing a number of challenges that we also need to recognise and work to address together. And those challenges are around ensuring that OPDs are not just at the table, but are engaged in a very meaningful way and are participating actively as equal partners in humanitarian response. So it was really exciting today to have the opportunity to bring together OPDs and humanitarian actors to continue this conversation and to continue advancing on this work under the broader localization agenda. Some of the key takeaways that I heard from our various panelists and interventions, one of them was around the importance of capacity sharing. We really heard about the very valuable experience, knowledge, and skills that local and national OPDs have, and that really need to be shared with humanitarian actors. We heard a lot of examples of this. We also heard at the same time about the importance of investing in capacity strengthening of local and national OPDs. So really ensuring that there's that two-way exchange of knowledge, experience, and skills. We also heard multiple times about the importance of intersectionality, so that as we're working to strengthen partnership with local and national OPDs, that we ensure that this also includes OPDs that are led by women, for example, that are led by refugees, and that we're engaging with children as also being rights holders and participating in the decision-making process. And in addition, we had a very important point about rural communities. So as we're looking at diversity and as we're looking at intersectionality, We need to make sure that we're addressing the unique challenges and opportunities in every context, and that includes in rural contexts or in areas that may be have a little bit less access to resources. So it's been a really valuable process of learning, I think, for all of us. And I'd just like to once again extend a big thank you to all of our panelists, and very much looking forward to working with all of you and to working with our DRG membership to continue advancing on this important work. And as a final note on that, we will put in the chat the link to join as a DRG member in case you haven't already. We always welcome more members. And thank you for joining us in celebrating International Day of Persons with Disabilities. Thank you.
Thank you. Bye.
Thank you all. Bye.